You're tuned to Radio Kidnappers, the voice of Hawke's Bay for the first time this year. It's our pleasure to have in the studio Heiko from the Acupuncture Clinic in Hastings. How again, Heiko?
I'm very good, Ken, and you? I see that we're still dressed up for our summer mode, just t-shirts.
It's balling outside, isn't it?
Yeah, I know, and it's going to be like Australia today, you know.
Yeah, it's over
30 today.
It's going to be 32 degrees, and tomorrow's not looking any better. I mean, some people might be saying yoo-hoo, but you can be too hot, can't you?
Yeah, and we've got a gardener coming in today at our house, so I don't envy her at all.
Do you have a veggie garden?
No, I don't, no. We've got a few herbs in pots. But
we have a veggie garden, and this year will be the worst year I've ever had, and I have vowed this year I'm never going to do it again. It's just a waste of time. You can go to the supermarket and buy them cheaper there, that's for sure. Yeah. Anyway, we're going to talk about what today?
We're going to talk about, it's a condition I think many people have heard of. It's called Restless Leg Syndrome. Have you, you haven't heard of that?
I've never heard of it. When I got your notes, I sort of had a bit of a laugh to myself. Well, Restless Leg Syndrome, what's that? What is that?
Yeah, well, it's a condition where it affects people mainly at night.
Yeah.
And generally they say it's people over 40.
Yeah.
And it's literally you're in bed at night, and then the legs are restless, and it prevents you from falling asleep.
Yeah.
Some people say that they can be like itchy. Other times they can be they feel like this sort of swollen, and it's like they've just, they're trying to get comfortable. They've got to move them, and then this makes them, I guess, irritable, impatient, and then you're trying to sleep, but then your legs are like, and it can be quite severe, and it's quite a debilitating problem, because then you have that, so then you don't sleep well, or have trouble to fall asleep. Then of course you're zonked out the next day.
Flows on, so you get a bit grumpy the next day. I mean, it has been around a long time. We spoke recently about fibromyalgia, and I was surprised to find that fibromyalgia hasn't been around for a long time at all.
Well, I have to say that the term or the name for it hasn't been around. Probably the symptoms have, the condition, if you like, or the classification of those signs. And it became sort of more, documented 20, 30 years ago, whereas, in a 1920s textbook, you wouldn't have had that word, fibromyalgia.
Right, so it's a different word,
But the restless leg syndrome, I can't tell you exactly if they probably didn't use the exact wording, restless leg syndrome, but it has been documented already in the 1600s, like in sort of medical textbooks. But it wasn't like officially till about around the 1940s, where it sort of was really being classified as a sort of a specific disease or problem per se.
Is there a cool name for it, or is it just restless leg?
Yeah, just restless leg syndrome.
So if I go to the doc and I say, geez, my leg's a bit restless, doc, what's he going to say to me?
Oh, well, you've got restless leg syndrome.
What's he going to say? He's going to give me drugs, or just saying just rub the leg?
Well, as I said there, again, because it's one of these conditions, you never die from it, so it's sort of like, well, you've got this thing, but you're not going to die from it, but it's just going to bother you for a while. They have a new thing that they call dopamine antagonists, which is a dopamine is like a chemical or transmitter you have like in the brain, and so then they use medications to try to try to calm you down, because their response. But to be honest, it's I don't think it's that effective. Otherwise, I wouldn't be getting many patients calling and inquiring and seeing patients for it. But what I did find was very interesting. Are you familiar with that website all called Neighbourly?
Yeah, I have seen it, and but no, I haven't.
Yeah, so basically it's sort of a New Zealand website, and then if you're in the Havelock area, you can sign up, and then it's a bit of a community thing, and you can post things like, I've lost my cat, or does anybody have a Louis XVI chair for sale, or something. But then people will just say, I've got really bad, and this was an interesting one, maybe about a year ago, I've got restless legs. What do you people out there do? And for me it was very interesting, just because you're reading about what the other people are doing,
Yeah, I was going to sign up for that Neighbourly thing, but I'm a bit of a conspiracist, because when I got onto that site, I saw that you had to put your name and your address and your email. I thought, what do you need to know that for? I want to know, where I lived. I thought, okay, I could say I live in Green Meadows, and I didn't have a problem with that. But I don't know about you, but people they all want to know too much about you.
Yeah, I think they do that as a security thing to say that you are actually someone that's really living in Havelock or really living in Hastings, and not that you have an Auckland person there trying to sell something from their, I don't know, their vitamins, or sell their artworks or something from somewhere else.
Yeah, perish the thought.
Yeah. But what was interesting is that, you had, for want of a better word, real people, local people who gave their ideas about, well, I had it. And one of the big ones that came across was magnesium. A lot of people said like magnesium really helped. But there were so many different things. I tried this, castor oil with this. I tried that, and rubbing it with this. I had this medication, that one didn't work. And so it's obviously, and it was a big response. So I think it just shows that there's a lot of it out there. A lot of people, I think, suffer from it to a small or to a major degree.
Now, we know there's nothing that acupuncture can't treat.
That's right. Well, I said, I couldn't help it. I sort of waited until I saw all these things, and I think I just put up my post, Acupuncture, Restless Leg Syndrome. I didn't take it any more than that, but put it out there, let the people make their own decisions if they want to work with it or try it. But I've actually had doctors as patients with it. So I think that sort of is an indication of I don't think Western medicine really has much to offer with it.
Okay, well, we might have the restless leg, but what causes it?
Look, from a Western medical perspective, that it's one of those things they don't really know. They suspect it's something to do with the nerves, and something to do with some sort of brain chemistry. But Chinese medicine basically says as we age, particularly once you sort of reach 40, then we say your levels or your reserves of yin and yang have basically halved. Yeah. Right, and then if it's been more damaged with other disease, chronic problems, you might have a history of bronchitis or work a night shift or history of fevers or anything like that, then you can have more serious type imbalances. And again, this concept of trying to explain on air of yin and yang, it's difficult to try to explain at any time, but fundamentally it's the balance between hot and cold, between water and fire, between the sun and the moon. Now, if for some reason the yin is too weak, it's become damaged, it leaves a residue of heat, fire. The time of nighttime is yin, which is passive, and so then that's why this yin deficiency problem comes up at night, because that's when the body's out of balance trying to cope with its yin deficiency.
Yes. So what other symptoms do we get with that yin imbalance?
There's a number of other symptoms, and again, I'll give you the signs and symptoms of general yin deficiency. Now that can be thirst and dryness. People wake up and they're thirsty and dry. They could, in severe form, they'll have a night sweat. If it's not so severe, they'll just wake up and be very hot. Other people, it tends to affect their feet, so that they get really hot, burning feet, have to stick them outside of the sheets at night. Then they wake up, then they might have to go to the toilet, and otherwise, you can have the restless leg. That's the heat starting to smoulder, and it makes that leg. It's just, if you think about, you're just heating up something, and it's just sort of starting to sizzle, right? That's what happens with the. Now you might have a little bit of all of those symptoms, or you might just have one of them. Then I'll get patients, and a common symptom is that the burning hot feet at night, and that's like a real common symptom.
Wow.
If you go and ask all your friends and all the people on air who has hot burning feet at night, and you got to stick them out of the sheets at night, you'll be surprised how many people. And again, you never die from it.
No, that's right.
So you just put up with it.
Now, what about the acupuncture? So what does that do? Does that bring the yin back into balance?
Yeah, and that's the fundamental treatment that we do, is to nourish the yin, to build up the yin. We have a system of meridians in the body. We call them the 8 extraordinary vessels, and they work like on constitutional weaknesses, imbalances, and one of them works on the yin of the body. And in that particular case, the points, there's sort of one near the wrist and one near the bottom of the large bone on the inside of the foot, and we treat those, and that we say that nourishes the yin. It accesses your internal reserves of yin to get it's a bit like you're accessing water from the dam to water your crop, or you have a water tank that you've been saving the water from when it's raining, and you use that for that's what you should have had for your garden. You see, a big water tank to keep those vegetables going.
Now, a couple of years back, you shattered everyone's illusions on this program by saying that if you've got a swollen ankle, then instead of putting a cold compress on it, you put something hot on it.
Yeah, you put the moxa on it,
So I'm presuming at this point, if we've got hot feet, we're going to use moxibussin rather than a needle.
Look, we use the acupuncture. You have to be careful with the moxibussin. You have to sort of know how to use it, because there's ways that you can use it to tonify and warm and strengthen, but you can also use the moxa techniques to take heat out. And for example, when you have this sort of internal heat condition, we might use little cones of moxa, like on the back. The patient is sitting up, and then we light the moxa on their back, and it sticks on with a little bit of an oil. And then as it burns down, and just as the patient starts to feel a bit of heat, we pull off the moxa. And then we say it's a matter of we're dragging out the heat. We're using fire to fight fire.
Yeah. So if we're suffering from hot feet, just getting away from acupuncture and moxibussin, so if we're suffering from hot feet, we're sitting there watching the old telly tonight and our feet are boiling, would you recommend that we get a basin of warm water and put our feet in it?
No, we wouldn't do that, because I think that would actually heat it up more. I mean, there's different acupuncture. When you'd probably be better off with that. You can use a cooling point here on the hand. You might better watch TV and press that one to help try and cool your body down.
How many treatments are we going to take to come right?
Again, it's like how long is a piece of string, but I try to recommend to give it at least a fair go to see how it's going to respond and work. I mean, I suggest sort of 6 to 10 sessions. Yeah. And again, it's relative. Is the patient 40 years old? Are they 60 years old? I mean, have they got heart disease and taking blood pressure medications? And have they had 8 children? And are they weak and deficient, or are they the strong, healthy constitution? So there's all those type of factors to take into account. But I think if you give it a fair sort of shot, 6 to 8 sessions, and often what you find it might be after a few sessions, people say, oh yeah, they're still there, but it's less. Yes. Or actually, I had one night last week where I fell asleep quite quick. So it's sort of like it's starting to change their body, as opposed to a drug that just tries to turn it around completely and keep it there. But
is it a thing that might pass? I mean, if you got it now, is it something that you'll not grow out of? But you know what I mean.
My experience is that it tends to not do that. It tends to stay. People who have it. Then they'll have it 15 or 20 years later, and then they might try other things. And some of these, as I said, some of these other things can help and will be beneficial. But I think if you get down and treat from our perspective, that root cause of that yin deficiency, then once that's regulated and balanced, then it should be long lasting and holding.
Just before we get to your weird song, and it is very weird, just remind our listeners, we want to come and see you for some acupuncture for the Restless Leg Syndrome, or in fact for anything else. Yep. Where are you?
I want you to go to my website, which is www.acu123.co.nz, and I'll put that link onto the comment section in YouTube, now that we're
yes, indeed,
we're firing away in all levels with lots of YouTubes coming up. We've got any other shows planned for the radio station? Extra YouTube shows with new?
We've got some new stuff coming up this year. At this stage, we want to get everyone onto YouTube. And it's just a matter of us finding the time to get everyone up. So at the moment, we've got half a dozen shows, because people just got no idea really how long it takes. Takes about an hour to do each show. Well,
you were saying that you'd like to work and finish at 1 o'clock, but if you could just finish at 8 or 9 o'clock at night,
that's right.
We could have that.
What's your song?
Oh well, it's a great song, and I'm sure that you've got it in part of your repertoire.
I'm sure.
It's Pink Floyd, and it's Set the Controls for the Heart of the Sun. And I chose that song just because it had the word sun in it, which is to do with yang and heat and fire, and sort of represents that restless leg syndrome.
I never heard of that song, to be perfectly honest, and I found a review which I've sort of found amusing, and I'm sure you'll find it amusing as well. It's actually a negative review, can you believe it?
Really?
And it's from a guy called John Miller of Rolling Stone, and he described the song as boring melodically, harmonically and lyrically. And he said it's not as glittery as the first albums, and the instrumental work is shoddy and routine. And he also described the track as being too long. Now, apart from that, apparently it's quite good.
Well, let's listen to it and let the audience decide.
As always, our pleasure. Talk to you next week.
Okay, I'll be here.